Good evening, dear students. Today you might see I am making a video in a different setup altogether. I actually have not recorded videos for more than 3 weeks, considering that the first year batch, which has just finished their exams, I wanted, and most of my audience are the first year students. So I wanted myself a break and also the students a break, so that after their exam immediately I didn't want them to bombard with the knowledge of anatomy. Okay, but I want to continue my endeavor of teaching anatomy to the students, and my students who are going to watch the videos will forward my videos to the new students who are going to take admissions in the recent future. So in continuing with the lower limb, last time we had talked about the plan of the lower limb in general. Today we'll talk about the very important part of the lower limb, that is the thigh. Okay, so we are going to talk about the thigh, and as we have seen in the upper limb, you have compartments of the upper limb. Similarly, here in the lower limb, you have compartments of the thigh. So in thigh being a larger area, you have four compartments here: anterior compartment, posterior compartment, medial compartment, and lateral compartment. Actually, these three compartments are very important because they are laden with muscles. The lateral compartment of the thigh does not have much. It has only one thing, which is modification of the deep fascia of the thigh, which is called as the iliotibial tract. Now, how we are going to consider this, because why you should understand this concept is because once you understand the plan of the thigh, you will never make mistakes in writing the nerve supply and the action of the muscles which are there. So as I said, there are four compartments: anterior compartment, posterior compartment, medial compartment, and lateral compartment. Now the anterior compartment, which muscles are there in this compartment? You have the quadriceps femoris. Now quadriceps femoris is a quadra meaning four. There are four muscles which are talked together as quadriceps femoris. These muscles are vastus lateralis, vastus medialis, vastus intermedius, and rectus femoris. So these four muscles together are going to form what is called as the quadriceps femoris muscle. Okay. Now the nerve supply of this anterior compartment of the thigh is the femoral nerve. The femoral nerve is going to supply here. Now you cannot talk of any other nerve in the anterior compartment of the thigh except for the femoral nerve. Okay, and the action here is extension of the knee joint. Okay, in general action I'm talking about. There will be some exceptions to the muscle, but in general the action of this compartment is extension. Okay, so that is about the anterior compartment. The posterior compartment of the thigh is called as the hamstring compartment. Now here also you have four muscles which are there in the hamstring compartment: semitendinosus, semimembranosus, adductor magnus, and biceps femoris. Okay, now adductor magnus and biceps femoris, when we are going to talk about this, it will be ischial part of adductor magnus and the part of the biceps femoris, that is the long head of the biceps femoris. Okay, so hamstring muscles are semitendinosus, semimembranosus, ischial part of adductor magnus, and long head of biceps femoris. These four muscles will be included in the hamstring compartment. The nerve supply of the hamstring muscles is the sciatic nerve. Okay, and the action of the hamstring muscle, these are flexors of the knee joint. Okay, now if you can correlate to the upper limb, or you can just make a contrast the upper limb. What we had seen in the upper limb, anterior compartment of the upper limb was flexor. In contrast, the anterior compartment of the lower limb is extensor, and vice versa. The posterior compartment of upper limb was extensor, and posterior compartment of the lower limb is flexor. Okay, so that is about the anterior compartment of the posterior compartment. The medial compartment is also called as the adductor compartment, where the adductor muscles are there. Here you will have again adductor longus, adductor brevis, gracilis, and adductor magnus. Okay, so those will be the muscles which are going to be present in the adductor compartment: adductor longus, adductor brevis, gracilis, and adductor magnus. These are the muscles which are going to be present in the adductor compartment. And the nerve supply of the medial compartment of the thigh is the obturator nerve. And the action of this compartment, as you can understand with the names, it is that these muscles are going to be adductors of the hip joint. Okay, now here if you see these two compartment muscles, this main action was on the knee joint. This is the adduction of the hip joint. Okay, so that is about the medial compartment. Then you will have the lateral compartment of the thigh, which has nothing actually. It's just a modification of the deep fascia of the thigh, which is called as iliotibial tract. And this is a very important modification which extends from the ilium to the tibia, and here two important muscles are inserted. You have gluteus maximus and tensor fascia lata. So these two muscles, tensor fascia lata, so these two muscles will be inserted here in the iliotibial tract, and this lateral compartment is considered to be the safest compartment of the thigh for giving intramuscular injections, especially in infants or very small babies. Okay, so that is what you should understand. So this is the general plan, and here these the nerve, there is no specific nerve supply here. Gluteus maximus is supplied by inferior gluteal nerve, tensor fasciae lata is supplied by the some other nerve. Okay, so this we'll talk later when we'll talk in detail about the iliotibial tract. Okay, so this is just to give you an idea how the plan of the thigh is. If you understand the plan of the thigh, you will understand which groups of muscles are there, what is the proper nerve supply, and what is the general action. So main part of your answer, when you are asked a group of muscles, you are to write in origin, insertion, nerve supply, and action. So two parts of your answer get cleared if you understand this plan of the thigh, that you will know the nerve supply and you will know the actions of this muscle. Okay, so I hope you have understood this plan of the thigh clearly, and I hope you will start following my videos. I'm really sorry for the delay that has happened in making the video. I will assure you that I will continue making videos in future, and I hope that you will follow my videos, like my videos, and kindly subscribe to my channel. Thank you.